Seeing your child have a seizure is just terrifying. So let's break down what's actually going on.
It's a scary but surprisingly common experience, a sudden fit when your child has a high fever. Basically, it's the brain's reaction to that quick spike in temperature. And no, it doesn't cause brain damage.
You'll almost always see these in kids this age. So, what should you be looking for?
Okay, a classic febrile seizure has 4 main parts. Let's walk through them real quick.
You might see their eyes roll back, maybe even some foaming at the mouth. It's scary stuff.
But here's the key thing. They're usually super brief and stop all on their own.
And right after, your child will seem really sleepy. That's a totally normal part of recovery.
So what should you do? Well, your actions in these next few minutes are absolutely critical. First thing, gently roll your child onto their left side. This helps keep their airway clear.
And this is so important. Do not put anything in their mouth. It can cause serious injury.
But what if it doesn't stop after 5 minutes? That's when you need to call for help, immediately.
In the ER, doctors have meds on hand that can stop the seizure, and fast.
Okay, once the fit is over, the new priority becomes getting that fever under control.
Make sure to use medicine dosed for your child's weight, and try some gentle sponging.
Now, are these seizures always harmless? Well, a doctor will always check for other serious issues.
The biggest thing they want to rule out is an infection called meningitis. It's really serious.
Signs like these point to possible inflammation, which is why tests are done right away.
Being prepared like this can turn your panic into calm, effective action. You've got this.
So you know how to handle the fit, but managing the fever is actually how you prevent it.